Are you experiencing a burning, itchy and flaky scalp which looks something like this? If yes, then you may have seborrheic dermatitis, which is a very common skin condition that affects millions of people worldwide. Hello everyone, I'm Dr. Umar Malik and welcome to Med Simplified. On this channel, we talk about health, fitness, wellness and common diseases, and in today's video, we're going to talk about seborrheic dermatitis. We will discuss what is seborrheic dermatitis, how it differs from dandruff, and what can you do to manage it at home and when to see a dermatologist. So let's begin. Seborrheic dermatitis is a chronic skin condition that causes redness, itching and flaking of the skin. It is a form of eczema that most often affects the scalp, but it can also develop on other oily areas of the body like your face, upper chest and back. The sweat glands in these areas of the body are known as sebaceous glands, and they differ from the rest of the sweat glands as they also secrete some special oily compounds like squalene, esters and cholesterol on the skin. It was earlier believed that seborrheic dermatitis develops due to the excessive oil production by the sebaceous glands, but later it was found to be untrue. As some of you may know, our skin has its own microflora. There are hundreds or even thousands of species of bacteria and fungi that live on our body, and these organisms are vital for the skin. They do not harm us, but instead they are very important for our skin. One such species of fungus that lives on our skin is known as MALASSEZIA. And earlier it was also believed that seborrheic dermatitis develops due to the overgrowth of this fungus. But later the research showed that this was also not true. Now, the recent studies have shown that seborrheic dermatitis develops due to multiple factors. The most evident of all these factors was a change in the type of oily compounds that are secreted by the sebaceous glands. Chemical analysis of these lipids from patients with seborrheic dermatitis showed increased presence of unsaturated fatty acids. When these unsaturated fatty acids are broken down by fungi like MALASSEZIA, it leads to the production of certain chemicals that cause inflammation of the skin. Due to inflammation, there is a strong immune reaction against the MALASSEZIA fungus, and this further leads to more inflammation and further progression of seborrheic dermatitis. The research also showed some other factors that were linked to the development of seborrheic dermatitis, like abnormal shedding of skin cells and epidermal barrier disturbances associated with genetic factors. So yes, there is also a genetic component linked to seborrheic dermatitis. Seborrheic dermatitis develops in people of all ages and races. While it can appear at any time, it is most likely to begin during the beginning of adolescence or adulthood. When a baby has seborrheic dermatitis, it usually appears on the scalp only and is known as cradle cap. It's also more common in adolescence as the sebaceous glands are more active under the hormonal influence, but also common in adulthood, usually beginning in a person's 30s or later. Other factors that can contribute to the development of this condition include stress, hormonal changes, obesity, poor skin care, environmental factors like pollution, the use of certain skincare products, particularly those containing alcohol, and using harsh soaps and chemicals over your scalp and body. Cold, dry weather and weakened immune system such as HIV has also been linked to seborrheic dermatitis. Now, many people have this question whether seborrheic dermatitis and dandruff are the same things. Well, dandruff may be considered the mildest form of seborrheic dermatitis, as it occurs over the scalp only. Unlike dandruff, seborrheic dermatitis may develop on more than scalp. It can appear on the ears, eyebrows, beard, or the skin around the nostrils. Sometimes it also appears on the chest, especially in men. The two conditions are similar in that they both cause white to yellowish scales which may be dry or greasy. Both these conditions also cause mild to severe itching depending upon the severity. Now let's talk about how you can treat seborrheic dermatitis. Remember, the right diagnosis is the key to receiving the appropriate treatment and managing your symptoms effectively. If you have seborrheic dermatitis, you know how frustrating and uncomfortable it can be. But you're not alone. While seborrheic dermatitis is a chronic condition that can be difficult to manage, but with the help of a dermatologist and the right treatment, you can find relief from itching, flaking, and redness and get back to feeling confident and comfortable in your skin. Treatment for seborrheic dermatitis typically involves the use of medicated shampoos, creams, and ointments that contain antifungal and anti-inflammatory ingredients. In more severe cases, oral medication may also be prescribed. The first step in managing seborrheic dermatitis is to maintain your skin hygiene. Keep your scalp clean by using a shampoo that contains ingredients like salicylic acid, pyroxenolamine, cyclopyroxolamine, zinc parathione, and selenium sulfide. Salicylic acid works by dissolving dead skin cells. In seborrheic dermatitis and dandruff, dead skin cells can accumulate, creating thick patches of dry skin and white flakes that can be very irritating. A salicylic acid shampoo can help by breaking down these patches while increasing the moisture in the skin to help stop them from forming. Pyroxenolamine, cyclopyroxolamine, zinc parathione, and selenium sulfide are antifungal agents that help to control the overgrowth of fungi on your skin. Some good products that contain these agents include shampoos like Selsun, Scalpe, and L'Oreal's Scalp Advanced Anti-Dandruff Shampoo. I have provided links to all these products in the description box down below. Please note that when you wash your hair, be sure to massage the shampoo into your scalp and leave it on for at least 5 minutes before rinsing it off. This gives the active ingredients time to work and can help to reduce inflammation and flaking. Remember to wash your scalp at least twice a week. After your symptoms clear up, use the medicated shampoos just once a week or once every 2 weeks. This will help to prevent a relapse. Like we discussed earlier, seborrheic dermatitis can develop on the face also. If you are experiencing such symptoms, in addition to keeping your face clean, it's also very important to keep it moisturized. Use a fragrance-free, lightweight moisturizer on your face and other affected areas to help reduce redness and dryness. Look for a moisturizer that contains ingredients like ceramides or hyaluronic acid, which can help you to repair your skin barrier and lock in the moisture. Again, I have given links to all these moisturizers in the description box. The ones that I have personally used and found to be the most effective are Requil Ceramide and Hyaluronic Acid Moisturizer and Ceramide Moisturizer from Minimalist. It is important to follow your dermatologist's instructions carefully when using these treatments to avoid further irritation or complications. If the symptoms still don't resolve, you can consult with your dermatologist for prescription strength shampoos and ointments for seborrheic dermatitis. These contain mild steroids like HYDROCORTISONE, FLUOCINOLONE, or DESONIDE. You can apply these medications directly to the affected area. While they are very effective in treating seborrheic dermatitis, this may cause side effects when used for an extended period. These include loss of skin color, skin thinning, and skin showing streaks or lines. Stress can also exacerbate seborrheic dermatitis, so it is very important to take steps to manage your stress levels. Try practicing relaxation techniques like meditation, deep breathing, or yoga. Exercise regularly and get plenty of sleep to help keep your stress levels in check. Finally, maintaining a healthy diet can also help you to manage seborrheic dermatitis. Avoid processed foods, sugar, and alcohol, which can all trigger inflammation and worsen your symptoms. Instead, eat a diet rich in fruits, vegetables, whole grains, and lean proteins. By following these steps, you can manage your seborrheic dermatitis and keep your skin healthy and comfortable. If your symptoms still persist or worsen despite these measures, be sure to see your dermatologist for further evaluation and treatment. Usually, if the shampoos and ointments don't work, you may be prescribed antifungal medications in the form of a pill or tablet. Learning to recognize and eliminate triggers that lead to flare-ups can also help you to manage seborrheic dermatitis effectively. Seborrheic dermatitis usually doesn't lead to any serious medical conditions or complications. So, this was all about seborrheic dermatitis. We at Med Simplified are committed to providing you with accurate and reliable health information to help make you informed decisions about your health. Don't forget to like and subscribe to our channel for more informative videos on health and wellness. I would really appreciate if you could make a small donation on our Patreon page, which helps us to keep making better content and keep it free. You can check the links to our Patreon page in the description box down below. Thank you again for tuning in, and we'll see you in the next video.